this video, kidney patients are being denied dialysis
with the insurance company over her dialysis to keep her alive.
Doctors are accusing health insurance companies.
The insurance company will deny it. I will call them. I will say the patient needs, why? Because of this. Did you get a CAT scan first? No, they don't need a CAT scan. They need an MRI. No, they do. And I have to argue for 45 minutes.
And people are being snitched out by McDonald's employee.
This is being hailed as a hero.
Catherine here. I'm a doctor of natural medicine. And today, I'm doing something I never thought I'd do. Brace yourselves. I'm here to apologize. Yes, you heard that right. Apologize to all the doctors, especially the PCPs, the primary care practitioners in my audience. Guys, I have said some things in the past, made some jokes, taken a few pot shots, we could say. Like that time I suggested PCPs always Google your symptoms as soon as you are not looking, or when I said, when a PCP says, let's run some tests, what they really mean is, let's see if the lab tech can figure this out since I have no clue. And let's not forget my all-time favorite when I said that the only time a PCP is certain about something is when they're certain you need to see another doctor. Yeah, I'm sorry about that. Oh, and that joke about double checking their prescriptions. What was that? Ah, yeah. When I said that whenever a PCP refers to a patient to me, I always double check their prescription to be sure it's not their doctor's grocery list. Yeah, good times. Well, I'm here to tell you, I'm sorry. Sorry for all of it. Okay, maybe not all of it, but you know, most of it. But that is now over. That was the old me talking. Now I had a moment of clarity. Let's call it a spiritual sucker punch. And yes, it has everything to do with the United Healthcare CEOs as and the fact that people are celebrating it like it's a national holiday.
Completely out of touch and insult the intelligence of the American people.
And yes, this completely changed my mind about family doctors and primary care practitioners. I mean, this really is something that should make you think, isn't it? A US citizen gets a on the streets of Manhattan, and instead of mourning the victim, people are glorifying the killer. And it's not just that. Have you read the comments all over the internet right now? People on social media are saying that their thought and prayers have been denied and that their empathy was out of network. I mean, guys, how bad must someone be for people to keep hating them this much even after they have been assassinated? And yeah, you know, times are strange when people are more inclined to set up a GoFundMe for the suspect's legal fees than to send a single condolence card for the victim. Yeah, the only condolence card this guy is getting is from the Grim Reaper saying, thanks for all the referrals. And this is where my worldview shifted. I knew the healthcare system was bad.
We all knew something was going on.
But this bad, it's like finding out your mildly eccentric neighbor is actually hoarding skeletons in the basement. Literally, skeletons. Now guys, here's a brief recap of what's happened for those of you that have been living under a rock for the past week. Or more likely, for those that have no time to watch the news because they are spending all of their time taking care of themselves or a loved one that is not receiving adequate healthcare due to a denied claim. I mean, isn't that the new American pastime? Not baseball, not apple pie, no, just wrestling with insurance claims until you're fluent in bureaucratic 101. Anyway, on December 4, 2024, Brian Thompson, United Healthcare CEO, was fatally shot outside a Midtown Manhattan hotel. The shooter was seen on surveillance footage. But the entire New York population as a whole decided that no, none of them was going to try to identify him.
Oh, no, I ain't seen nothing. I'm blind in my left eye.
Yeah, so here's the twist. A man was shot in the middle of Manhattan and not a single soul saw anything. The police started then investigating anyone with a motive for this crime, a personal reason to want the United Healthcare CEO to be more, they say. However, the suspect pool was as long as the hold time on United Healthcare's hotline. After that fruitless investigation, the primary suspect, Luigi Mangione, was apprehended Monday, December 9, in a McDonald's in Pennsylvania. Because, of course, who could have snitched him if not a McDonald's employee? I mean, if you need yet another reason not to eat at McDonald's, here it is. But here's an important detail. What we know is that the ammunition used had the words deny, defend, and depose written on the shell casings. Yeah, looks like someone finally found an effective way to file a claim directly onto the CEO. Okay, it's a dark joke, I know, but we live in dark times. But what do the words deny, defend, and depose even mean, you may ask? Well, these terms are connected to a book by J.M. Feynman about health insurance claims. And this leaves no doubts about the reason of the homicide. In fact, this incident didn't just open Pandora's box. It shattered Pandora's box of hatred towards United Healthcare and health insurance companies in general.
Discharge fee, discharge paperwork, something.
So this is where we at right now. And before anyone gets political, let me be clear. This video isn't about politics. By the way, I wrote most of the script for this video before the arrest of the suspect Luigi Mangione that happened this Monday. So I didn't even know what his political affiliation was. I don't have a dog in that fight. I'm too busy trying to help patients that are not able to get the prescriptions they need. No, this is not joke. I have patients from all over the world, and trust me, I can tell you if someone is from the US without even asking. Yes, this video is all about the victims. Yeah, victims with a S. Not the millionaire CEO, but the poor people that are not able to receive essential health care because of a denied claim. And shocker, doctors are getting screwed too. I bet you didn't see that coming. The list of victims includes doctors as well. Doctors today are literally being scammed by United Healthcare as well through an elaborate scheme that has been called a payday loan. And many doctors have even gone on record accusing health insurance companies.
The insurance company will deny it. I will call them. I will say the patient needs, why? Because of this. Did you get a CAT scan first? No, they don't need a CAT scan. They need an MRI. No, they do. And I have to argue for 45 minutes. Yeah. Guess what I don't get paid for? Order antibiotic. I don't know which tablets, capsules. The patient's insurance denies the visit because I didn't put the right code or this and that. I'm a doctor. I do science. I do the body. I don't do codes.
I mean, imagine you're a doctor, 10 years of training, internship, residency, only to have an insurance rep treat you like you're selling used car parts. They won't cover a stethoscope unless you prove it's not recreational equipment. But guys, of course, those that absolutely need to be heard, the real victims here, are the patients. Because there are people out there that are being denied anesthesia during surgery.
You think that I didn't need anesthesia to have surgery? You're insane.
And these kind of stories need to be heard. Any exposure on social media they can receive is going to be important.
Over her dialysis to keep her alive.
People are upset.
And this woman is fighting today to get her mother to get kept on dialysis. I mean, imagine paying insurance premiums for decades and right when you need them to, pay for what's right, they say, nah, we would prefer to just keep the money. Your mother can just What's more, this mom's child was denied coverage for an EpiPen.
Someone, or peoples, at United Healthcare looked at the claim that my child, who was under a year old, needed epinephrine. It's called an AviQ pen when they're that little. Denied.
So, her child needed the EpiPen for potentially fatal allergies, but no. Denied. Yeah, apparently allergies are a lifestyle choice now. And of course, these are not the only horror stories of infinite greed. A woman named Yolanda shared on X that United Healthcare denied her surgery just 2 days before it was scheduled. She was in tears at the hospital finance office, and her surgeon was fighting with the insurance for her case. So, here we are, guys, a nation of victims. Patients and doctors alike trapped in a healthcare system that cares more about quarterly profits than the people it's supposed to serve. Let's keep sharing these stories because the more we talk, the louder the message. This isn't healthcare, it's highway robbery. And yes, unfortunately, I could go on with these stories for hours, as many other YouTube channels are doing. Heck, you're probably already seen half of them on other YouTube channels. But do you know what's not getting nearly enough attention? The actual methods behind how these claims are managed, or more accurately, mismanaged. Enter the AI billing. And you probably won't believe this. United Health is using faulty AI to deny elderly patients medically necessary coverage. That's right, a lawsuit filed last year alleges that United Health deployed an AI system called NH Predict, which, by the way, has a 90% error rate. 90%! I mean, you have better odds getting medical advice from a magic 8-ball. So yeah, the AI model reportedly has a 90% error rate and it can override your doctor's decisions. Okay, so imagine this for a moment. Your doctor decides that you need a medicine to, survive. This is not hypothetical. Both the patients passed before the lawsuit was filed. 2 elderly patients literally before their lawsuit was filed. Think about that. They didn't to illness, to corporate greed. United Health's algorithm had one job: save them money, not save your life. So your doctor determines you need a medication, and United Health's botches ChatGPT says, nope, we've crunched the numbers and our profits don't like this treatment. And before you know it, there is 6 feet under by a robot. The fallout: elderly patients prematurely discharged from health facilities, forced to burn through their life savings just to receive basic, essential medical care. Imagine working your whole life, saving for retirement, only to have your golden years stolen by a robot accountant with zero medical training. If this were fiction, no one would buy it. Honestly, if someone wrote a novel about AI overriding doctors' decisions a decade ago, you'd laugh it off as absurd. What kind of dystopia nonsense is this? But here we are, living it. And today, it's not your doctor deciding your treatment anymore. It's ChatGPT with a corporate agenda. Its only goal: to make United Health more money. I mean, it was already bad enough when ChatGPT started making fake YouTube videos and bogus Facebook posts. Now, they're using it to replace your doctor. Yeah, they finally replaced do not harm with do no payouts. This isn't healthcare. It's a dystopian nightmare brought to you by corporate greed. And if we don't call it out now, who knows what's next? A chatbot replacing ER doctors, Siri performing surgeries. We're teetering on the edge of absurdity, and it's time to fight back. Not in a violent way, of course, but your health shouldn't depend on the whims of a profit-driven algorithm. Speaking of which, sorry guys for all the beeps and blurred words, but You see, the YouTube algorithm doesn't really want me to talk about this kind of stuff here, and I don't want this video to be cancelled. In any case, let me know what you think about the recent events, and this is all for today. Thank you for watching. God bless you all. Take care. Bye-bye.